My name is Tom Kelly. I work for NHS Greater Glasgow and Clyde. My job is called Change Manager. This means it is my job to help all of our staff think about how we can make learning disability services better and make changes happen. People with learning disability don't always need what we call specialist learning disability services, but when they do, we want to make sure they are as good as they can be. Last year we decided we needed to think about how learning disability services need to change to make sure we provide health services that people need in the future. We want to make sure that people with learning disabilities have good health. As well as listening to what people with learning disabilities think we need to do, we have also read a very important new plan which was launched by the Scottish Government called the Keys to Life. The Keys to Life makes lots of recommendations about how the NHS can improve people with learning disabilities' health. We are going to make sure that we include these plans in NHS Greater Glasgow and Clyde. We think that specialist services need to do two things. One, to help all NHS services better understand the needs of people with learning disability, and two, to provide healthcare when people have problems that need special knowledge about learning disability. We have been speaking to a lot of people about what learning disability services need to do in the future. Last year we met with a group of people with learning disabilities who told us about the things we need to do better. We have also spoken to staff, carers and care providers. All of these people have given us some good ideas and we've written a plan. This plan sets out what we need to do. Now that we have our plan, we're going to be asking people what they think about the changes we want to make. In this short film, you're going to hear from all of the different types of staff who work in learning disability services. They are going to tell you about what they do and what they are going to do in the future.
Hi, I'm Linda Allan. I'm Head of Profession for Learning Disability Nursing in Greater Glasgow and Clyde. A learning disability nurse is a nurse that specialises in working with people with learning disabilities. Learning disability nurses are part of a big nursing family. So we have nurses working in hospitals, nurses working with doctors' surgeries, and learning disability nurses have undergone specialist training to work solely with people who have a learning disability. They work in some hospital settings, but mainly work in community settings where they visit people at home and work with them and work with their families and people who provide support to people with learning disabilities. Learning disability nurses do lots of different jobs. They'll work with people to find out what's wrong. That could be working with people who maybe are feeling angry or sad, or people who are not very happy at home, or people who have something physical wrong with them. So they maybe have chest infections that come back often, or have problems with accessing their doctor's surgery, accessing hospitals. So they do a wide variety of things. They also work sometimes with other nurses and doctors that people without learning disabilities see, to help them support people with learning disabilities. In the future, learning disability nurses need to think more about working with people, with nurses and doctors that work with everybody who doesn't have a learning disability. We know there's about 5,500 people with learning disabilities in Greater Glasgow and Clyde, and not all of those people will have a learning disability nurse, but all of them at some point will have seen a nurse at a hospital or in a doctor's surgery. So learning disability nurses, as well as doing very specialist things with people with learning disabilities, need to make sure that they're working hand in hand with the nurses that everybody see to make sure that people access mainstream services. We also need to make sure that learning disability nurses do the same no matter where they work in Greater Glasgow and Clyde. We need to make sure that if they work in Eastern Bartonshire, Western Bartonshire, Glasgow City, East Renfrewshire, they all do the same thing as each other. Just now we know that things are a wee bit different across Greater Glasgow and Clyde, and we want to make sure it's the same no matter where people live.
My name is Dr. Smiley. I'm the Clinical Director for Learning Disability Services and the lead Learning Disability Psychiatrist. Psychiatrists are doctors that have had special training to help people who have problems with the way they think, feel and behave. You may need to see a psychiatrist if you're very unhappy or confused, or there has been a change in your behaviour. Learning disability psychiatrists have a good understanding of all the health problems that affect people with a learning disability. Psychiatrists are good at working out how to help you if you have problems with your thoughts, feelings, or behaviour. They know a lot about medication, when it might help you, how to take it safely, and when you can stop it. They also know a lot about other treatments for problems with your thoughts, feelings, and behaviour, such as the way you spend your time during the day, or the way other people help you with your problems. They know how to decide if you need treatment in hospital. They also know how to decide if you need help to make important decisions. In the future, learning disability psychiatrists will give more support to other people in the community team to help you with your health problems. They will only see people when they need the help of a learning disability psychiatrist. They will give more help to the community teams to make good decisions on how to keep you safe and healthy. They will give more help to your GP and hospital doctors if they are having difficulty understanding your health problems. They will have more time to give you treatment at home and will try hard to avoid you coming into hospital. If you do need to come into hospital, they will try hard to get you back home as soon as possible.
Hello, my name is Jennifer Crockett and I am the manager for the physiotherapy services in Learning Disabilities. Physiotherapists work with people who have problems with their body shape and muscles and joints, which makes it difficult for them to sit, move or walk. The physiotherapist helps people with their posture or position in sitting and lying, which may include advice on their wheelchair or other seating to ensure they are as comfortable as possible. They also help people with their walking and help to get them walking again if they have had a fall or have been in hospital. This will include exercises which can be carried out in the pool, on the trampoline or on a mat or as part of a group. They also provide some equipment to make walking easier or to move about your home. In the future, the physiotherapist will work more closely with people with learning disabilities to ensure we are offering the right kind of service and the same service in every area. We plan to start up clinics in each area to assess and monitor people's posture to ensure they are seen on a regular basis.
My name is Gillian Miller and I am the lead occupational therapist. Occupational therapists work with people with all types of learning disability, helping them to carry out the activities that they need or want to do in order to lead healthy and fulfilling lives. Our aim is to enable people to achieve as much as they can for themselves so they get the most out of life. People with learning disabilities may have certain difficulties in everyday life, so as an occupational therapist, we can help people find new ways of doing things, make changes to people's homes and provide equipment so they continue to be able to do things for themselves, and talk to other services to plan the right level of support people need to live at home safely. We will continue to offer this type of support, but we also need to think about how we support people in the future. At the moment, some people get different services or need to wait longer for services depending on where they live, and we need to change this. We need to talk to social work occupational therapy services and make sure people can get support and advice from them when appropriate. We want to support people with autism and their carers as they often have difficulties coping at home due to sensory problems, and we can provide advice and support to create a calm and relaxing atmosphere, as well as offering advice on other activities people may get enjoyment from. Occupational therapists will continue to develop relationships with people and work alongside our service users and their carers to agree their current support needs and help plan for their future.
Hello, my name is Maurice Boyle. I'm the lead podiatrist for the Learning Disability Service. Some of you may also know me as the chiropodist. Podiatry is the modern term we now use, and there's no difference between a podiatrist and a chiropodist. Both look after your feet. Podiatrists are a bit like a foot doctor who can help you if you have a sore foot, chatting to you, your family or carers about ways of keeping your feet healthy and happy. As learning disability paediatrists, we visit and treat people in their day centres. Some of you might be treated in your workplace, others at home, or perhaps you come to see us where we have learning disability clinics in your local health centre. We can provide treatment for ingrown toenails or toenails that have become thickened or might be infected with a fungal infection, which can make your toenails become brown and crumbly. We can gently smooth away hard skin and corns, since these make walking uncomfortable, and chat with you about ways to prevent the corns coming back. It's very important to look after the skin on your feet and to prevent the skin cracking and forming hacks, especially around your heels. This is very important if you have diabetes, and you should always see the paediatrist to have your feet checked. People in wheelchairs should also have their feet checked by the paediatrist to make sure their feet are healthy too. We also work alongside other people in the learning disability team, such as nurses, occupational therapists and psychologists. We also work closely with the team's physiotherapists, who may also go with you to the hospital to see about your special footwear. And so to the future of the Learning Disability Paediatry Service. It appears likely that paediatrists will move out of the learning disability teams. In the future, more people with learning disabilities will be encouraged to go to their local health centre for their foot care and treatment, providing opportunities for you to meet different paediatrists. Some of you may also be asked to try personal foot care, where with the support of your family or carers, you look after your own feet at home, cutting or filing your toenails and smoothing away your hard skin. Please remember, it's very important to look after your feet to help keep you fit and active and do all the things you like to do, like dancing, walking, bowling or playing football. Thank you for listening.
Hi, my name is Fredrica DiMascio and I'm the professional lead for dietetic services within the learning disability teams. A dietitian knows about the effects of food and drinks on your body. The dietitian in the learning disability team works with people who need help with what they eat and drink in order to keep them as healthy as possible. The dietitian may ask you to change some of the things you eat and drink, maybe because you're not well and you need to get better. Dietitians will help people who need special diets because of medical conditions they have, like diabetes, food allergies, etc. The dietitian working with people who have learning disabilities will visit you at home, in the centre or any place that's important to you. We make time to talk to you and your carers, people who support you and other members of the healthcare team, so that we can try to get to know you as best we can, so that we can make an eating and drinking plan that best fits with your health needs and your lifestyle. We have special equipment and leaflets designed to help us help you. Some people are underweight and too skinny, which can make you feel very ill and perhaps end up in hospital. The dietitian would talk to both you and the people who help you about how to eat and drink things that have more calories and energy in them to help you to try and put weight on. We might ask your GP to prescribe special food and drinks to build you up. Some people have problems chewing and swallowing their foods and drinks. The dietitian would show you and the people who support you the best ways to make what you eat safer for you to swallow by maybe mashing it down or blending it, and making what you drink safer to swallow by making it thicker. We will continue to ensure you receive a good quality service in the future as the changes happen.
Hi, I'm Sharon Symon, and I'm here to talk about what speech and language therapists do in the Adult Learning Disability Service. Speech and language therapists' work is about communication. Some people with a learning disability have problems speaking or understanding, and we can help by introducing other kinds of communication. So this might be easy words, or pictures, or signs, or objects. Everybody that works in the Learning Disability Service has to be good at this kind of communication. So we run training courses in inclusive communication too. If communication's poor, people with learning disabilities can be left out of things that they should be included in, like making choices and decisions about their own lives. it really matters that people are included. So in the future, we'll be doing even more of this kind of work. Speech and language therapists can also help if people have difficulties with eating, drinking or swallowing, because those kind of difficulties can lead to problems with health. We help by assessing and giving advice on how people can eat and drink safely. And we also run training courses so that carers and support workers know how to do that too. Speech and language therapists can help people with learning disabilities to communicate, to be included and to stay healthy.
My name is Lindsay McNair and I'm the lead psychologist. Psychologists work with people who have problems relating to how they think, feel or behave. We support people who might have problems such as anxiety, depression or mental illness, and people whose behaviour may get them into trouble or make it difficult for people to support them. We also provide support for people who may have difficulties with their memory, such as dementia, and help people cope with physical illness. In order to help people, clinical psychologists will carry out a range of assessments. Psychologists will add all this information up to develop an individual treatment plan with each person that they see. These treatment plans involve helping people understand their problems and suggestions for how to make these things better. This will usually involve helping people make changes to how they think, feel or behave. Psychologists do not use medicine to help people. They will talk to the person, and as people with learning disabilities often have other people who support them, they will sometimes involve these people too. To provide the service that people need and want in the future, psychologists will continue to work with people who have significant psychological problems, but will take a role in helping other professionals and teams. This will mean psychologists spending more time training and supervising other professions.